Welcome to this educational program. This module provides a general introduction to Peyronie's disease. This information is taken from a recent review of the medical literature and attempts to be as transparent and comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Peyronie's disease is a condition that leads to scar tissue that can cause the penis to remain either curved, bent, deformed, or shortened during erection. Early on, it can cause pain during erection. Peyronie's disease can also cause erectile dysfunction, a situation where a man is unable to obtain or maintain an erection. Peyronie's disease is named after François de la Peyronie, who was a brilliant surgeon in France in the 18th century. He was sought after to treat many a royal family member, including Peter the Great, and actually became Louis XV's court doctor. As to whether or not there is any relation between his royal patients and de la Peyronie's namesake disease is up for speculation. What is known is that La Peyronie published a detailed description of Peyronie's disease for the first time in 1743, although the disease had been in the medical literature for hundreds of years before that. Peyronie's disease was thought to be relatively common, although statistics are not firm in the literature. Unfortunately, it tends to be kept under wraps, as sexual problems and erectile dysfunction are sensitive matters for most men and their partners. With more men talking about their erections in the past few years, however, thanks to drugs like Viagra, it is now understood that Peyronie's disease is more common than initially thought. Several studies indicate that anywhere between 0.4 and 8% of men may have Peyronie's disease. That's up to 8 men in every 100. Most of these men are middle-aged, between 45 and 60 years. But patients with this condition can be of any age. Peyronie's also affects men of Northern European descent more commonly than other ethnic groups. In order to better understand Peyronie's disease, you need to first have some knowledge of the anatomy of the penis. The penis contains 3 chambers. The 2 on top are called the corpora cavernosa, or erectile bodies, which run along the length of the penis and attach to the pelvic bones. The 3rd chamber is beneath the 2 corpora cavernosa and contains the urine channel called the urethra. The corpora cavernosa contains spongy tissue made up of smooth muscle, fibrous tissue, veins, and arteries. Spaces called sinusoids within this tissue can fill up with blood during erection and expand the corpora dramatically. The expansion of the corpora compresses the veins in the penis, preventing leakage of blood. All of this tissue is surrounded by a very strong fibrous coating called the Tunica Albuginea. This is a more detailed look at the Tunica Albuginea, the thick fibrous coating around the penis that helps hold blood in and limit the expansion of the penis during erection. You can see that the tunica is actually in layers. In Peyronie's disease, 1 or more plaques of thickened scar tissue develops in the tunica, which limits its ability to expand on that side. The result, when the opposite side expands normally during erection, and the affected side cannot, is a curve toward the side with the plaque. This figure shows how a plaque on the upper side of the penis causes it to curve upward as that side cannot expand properly during erection. There are several reasons why a man with Peyronie's disease may also experience erectile dysfunction, or ED. Firstly, ED is common amongst the general population, so any man can suffer from it, regardless of whether or not he has Peyronie's. Peyronie sufferers, however, may also have ED because of psychological or physical effects. The abnormal appearance of the penis and pain with erections may cause embarrassment or fear, which might limit his arousal. The plaque may also physically block blood flow into the penis or interrupt the normal mechanisms that keep blood in. Men with Peyronie's often notice that their erection is less rigid beyond the area of scarring. Along with the ED, in some men, the curvature caused by Peyronie's can be severe enough to interfere with penetration during intercourse, or cause discomfort to his partner. Fortunately, however, most men with Peyronie's disease are able to function adequately. How do you know if you have developed Peyronie's disease? You may have some or all of the following symptoms. When your penis is erect, you may feel pain. Your penis may no longer be straight when erect, but have a new bend or curve to it, sometimes almost to a right angle. Your penis may be shorter than previously when erect. And/or you may notice hardened areas that feel like lumps along the shaft or length of your penis. These hard lumps are called plaques. In more severe cases, you may not be able to have an erection. These symptoms may develop over a long period of time or may shock you by happening quite quickly. Some males are born with a penis that was bent or curved. This is not Peyronie's disease. By definition, Peyronie's disease is an acquired disease, meaning something that you develop later in life, and not a disease you were born with. You may wonder if this lump or hardened area in the shaft of your penis may mean that you have an infectious disease. The answer is no, if you are diagnosed with Peyronie's disease. If you are still able to have sexual relations, you should feel free to do so in the same way you did before your Peyronie's diagnosis. In seeing a lump or change in the shape of your penis, you may also worry that you have cancer. If you are diagnosed by a physician with Peyronie's disease, there is no need for this worry at all. There is no evidence that cells of Peyronie's associated plaque are malignant or cancerous. So what causes Peyronie's disease? It appears to be a stepwise process. The first stage likely involves direct physical injury to the penis, rarely from a single incident where the tunica gets torn or fractured during sex, and more commonly from minor repetitive trauma over time, usually during sexual activity. This trauma can cause bleeding in the shaft of the penis, and the body responds to this injury with an inflammatory reaction through the release of special molecules called free radicals. This inflammatory reaction leads to scar tissue formation. Normally, this scar would be minor and would soften with time. In certain susceptible individuals, however, abnormal and excessive scar tissue formation occurs, leading to formation of plaques in the shaft of the penis. Factors making certain people susceptible may include inherited factors, autoimmune factors, and abnormal connective tissue. Certain medications may also trigger development of Peyronie's disease, and other risk factors may also contribute. Peyronie's disease may run in some families. It won't affect all males, but if you have one or more family members with Peyronie's, you have a higher chance of developing it. In addition, if you or family members close to you have Dupuytren's contractures, you may be at risk of developing Peyronie's disease. Dupuytren's contractures are an abnormal thickening of the tendons of the palms, which can cause the fingers to curl inwards. Some studies have indicated that up to 20% of men with Dupuytren's contractures have Peyronie's disease. Some Peyronie's disease patients may also have an autoimmune disorder. These are conditions where the body's immune cells attack the body's own cells instead of foreign agents. Examples of autoimmune diseases include multiple sclerosis and lupus. The reason for this link is unclear, but the same process that makes the body's immune cells attack the body's own cells in autoimmunity may contribute to the excessive scarring and plaque formation on the penis in Peyronie's disease. A step in the process of plaque formation likely involves excessive connective tissue production in the Tunica Albuginea of the penis. Connective tissue is the tough material that scar tissue, tendons, and cartilage is made of, and consists of substances such as collagen and fibrin. In a normal healing response to injury, the body lays down collagen and fibrin in the injured region of the Tunica Albuginea of the penis. This is what forms the scar tissue. If the body overdoes this response, then you get the hard plaque formation you see in Peyronie's disease. You may have heard of so-called superfoods like blueberries and broccoli that are great antioxidants. These foods tend to be high in vitamins C and E, among other nutrients. The targets of these antioxidants are special molecules in the body called free radicals. Free radicals are generated all the time in the body as a byproduct of normal metabolism and immune function. When your body is unable to get rid of free radicals, they can destroy cells in your body. In Peyronie's disease, free radicals are thought to be produced during the repeated inflammatory response to injury to the penis, and they may target cells of the Tunica Albuginea. While technically not Peyronie's disease, it should be pointed out that one of the most common causes of penile curvature is the injection of medications into the penis for the treatment of erectile dysfunction. These drugs work extremely well in stimulating an erection, but unfortunately can have the side effects of causing excess scar tissue formation and plaques, just like Peyronie's disease. Older medications, such as the drug papaverine used alone, were much more likely to cause this than modern drug combinations. Certain medical procedures may result in injury to the penis and plaque formation. These may include prostate cancer surgery, having a traumatic cystoscopy, an imaging of your bladder where a telescope enters through the urethra, or a difficult catheterization through the urethra. Some prescribed medications may contribute to Peyronie's disease in rare cases. The most common of these drugs are a class called beta blockers. Beta blockers are typically used to treat high blood pressure and heart ailments. It is not known how these drugs cause Peyronie's, but this disease is listed as a rare side effect. A migraine medication called dimethylsergide, or Sansert, has also been associated with Peyronie's. It is also now appreciated that general risk factors that can affect your heart and blood vessels can also be associated with Peyronie's disease, including diabetes, high blood pressure, and smoking. Alcohol intake is another risk factor. These factors may predispose the penis to injury by causing loss of rigidity and increased potential for bending and injury. To review, besides penile trauma, there may be risk factors that increase your chance of getting Peyronie's disease. Your age probably plays a factor, since elastic tissues, such as those found in your penis, do not heal as well as you get older. As we've discussed, there may be a genetic factor, and family history plays a role. There seems to be a higher number of men of Northern European descent that have Peyronie's, leading to this ethnic link. Certain medical procedures and drugs may impact on the development of Peyronie's disease. Finally, risk factors such as diabetes, high blood pressure, smoking, and alcohol intake may also be important. Diagnosis of Peyronie's disease by your doctor is usually straightforward and usually only includes a careful medical interview or history and a physical examination. Your doctor will ask you questions about when you first notice your symptoms, what activities you may have been performing that aggravated your symptoms, whether you have hardened tissues anywhere else, whether you have family members with Peyronie's disease, what medical procedures you may have experienced recently, and what drugs you may be taking. You will also be asked to estimate the degree of curvature or deformity of the penis and any changes to sensation in the penis or the ability to have an erection. He or she will also need to know if the curvature is causing any functional problems with your ability to have intercourse, such as discomfort to you or your partner, or the need to use only certain positions for intercourse. He or she will also want to know if the condition has changed over time, for better or for worse, and if you are having any pain or discomfort with erections. Your doctor will then perform a physical examination, which focuses on the genital region, but also includes a general examination. If you do have Peyronie's disease, the hardened plaque can usually be felt by your doctor when examining the penis. It is helpful to bring in a photo of your erect penis from different angles to show your doctor the degree of curvature or deformity. If there is any question of the diagnosis, and if your doctor needs to get a better impression of the severity of the situation, he or she may induce an erection by injecting a small amount of medication directly into the shaft of the penis. Rarely, or as part of a research protocol, a doctor may order an ultrasound to further assess Peyronie's disease. Ultrasound is a non-invasive process that uses sound waves of high frequency to generate pictures of the body's tissues and organs. An external probe is passed over the penis to generate a clear image of the plaque area. If you have been diagnosed with Peyronie's disease, you have already been experiencing the negative effects, but can look forward to positive changes. The negative effects you may have experienced include pain when you have an erection, or perhaps difficulty in achieving an erection. The erection pain and difficulties and the bent shape of your penis may make it difficult or even impossible for you to have normal sexual intercourse. This can lead to problems with your intimate relationships and marriage. You may also feel somehow disfigured and have a negative self-image. All of this may lead to emotional stress and a diminished sense of well-being. It is good to know that Peyronie's disease can be managed, and your doctor can help. The next module in this series discusses in detail the treatment options available for Peyronie's disease. In summary, Peyronie's disease is a condition of bending, shortening, or deformity of the penis. It may be accompanied by painful erections or even an inability to achieve or maintain an erection. The hallmark of Peyronie's disease is a lump or plaque formation on the Tunica Albuginea along the shaft of the penis. Peyronie's disease is relatively uncommon, affecting between 0.4 and 8% of men. It is more common in men of Northern European origin who are middle-aged and have a family history of hardened connective tissue diseases. The cause of Peyronie's disease is not clear, but likely starts with direct trauma to the penis, which leads to bleeding in the tunica layer, inflammation, and scarring. Additional causal factors may include genetic predisposition, autoimmune factors, abnormal connective tissue response, and excess free radical release in the tunica. Patients may also be impacted by having had invasive medical procedures affecting the penis and being on certain medications. When you visit your doctor with the possibility of having Peyronie's disease, you will undergo a medical interview and a physical examination that includes an assessment of your penis. It is helpful to bring photographs to demonstrate the condition to your doctor. This slide lists some of the many resources available where you can find more information about Peyronie's disease. These current references were used to assist in the preparation of this module. All of these are available through your local medical library if you are interested in more detailed reading on this subject. These references were also used. We sincerely hope that this module has furthered your understanding of Peyronie's disease. We wish you the best for the future, and thank you once again for viewing this educational program.